So from your vantage point, what are you most excited about in the next 5 to 10 years?
What we see today around us, it will look like a relic. 10 years down the road, we will not be having a checkup once a year. We'll be monitoring our health condition 24/7. We're going to have more inclusive societies, healthier populations, more productive societies.
So you're CEO at M42, which is an Abu Dhabi-based global healthcare company. Tell us a little bit about M42 and a little bit about you.
M42, today we have presence in 27 countries. We sit at the intersection of artificial intelligence, genomics, digital health technology, and world-class specialty care. We use AI both at the health system level, at the patient level, and the population level.
There is this broad understanding that AI will be transformative in a very positive way for the healthcare sector. Do you agree with that? And how?
I agree 100%, and I think that it will positively impact healthcare across main domains. In life sciences, the speed in which we develop drug will convert several uncurable diseases now to chronic diseases or cure them in the long term. We see a massive productivity, and we see AI giving precise, predictive information to the physicians to deliver care. I think we're going to see a closing of the different inequities across the planet. In our case, in the case of Abu Dhabi, we are tapping to genomics data. Today, M42 is the custodian of 3.9 billion clinical records. To biological data through our newly introduced biobanks, even to environmental data. And utilizing all this data, we can predict disease both at a patient and population level, and we can act before it happens.
What's the biggest burden on the Abu Dhabi healthcare system at present?
I would say the biggest burden are chronic diseases, oncology, cancer, cardiovascular-related diseases, are diseases which are preventable. And this is an area that Abu Dhabi, together with us, is looking to tackle, identify them early, and ensure that they will not be inherited also to the next generation.
Dimitri, before joining M42, you served as head of one of the world's leading global renal care providers, which focused on AI and advanced tech to provide high-quality renal care at scale. M42 has just launched kidney.com, which is an AI-powered platform for chronic kidney disease. I think that's a really good example of how you might best sort of explain the work that you are doing. So talk to me about that.
So I think we have two main breakthroughs. One is that we have developed an AI-powered kidney care model, which ensures personalization of the way the treatment is delivered, and we can predict conditions before they happen. At the same time, this comes with a reduction of the cost of care of the system as the patient has no complication.
Kidney disease, as I understand it, is tied to long-term conditions like diabetes and hypertension. Does this point to a future where patients get continuous support before they become seriously ill, rather than only entering the system once the disease has advanced? That's the point, is it?
This is exactly the point. I mean, today, a patient during hemodialysis has to come every second day in one of the M42 clinics to receive a kidney function for 3.5 hours every second day. While our kidneys function 24/7, these patients have a kidney for 3.5 hours every second day. We don't know what they're doing until they come back. With kidney.com, we aim to introduce a digital condition management system, which will be retrieving data through wearables, and will be using this data across the patient's life in order to optimize treatment and ensure the patient longevity.
So why kidney.com? I can just go to, surely, Claude or ChatGPT and ask the same questions, right, at this point?
Because kidney.com combines 35 years of hemodialysis kidney care experience from M42 Diaverum with the AI experience of M42 today. It has proper guardrails, so it does not hallucinate. Today, it's hosted in instances, in data centers, which ensures the right data privacy.
How on earth are you ensuring the privacy, security, and sort of ethics around the collection of that amount of data?
Let me say that there's a federal law which ensures the highest privacy of data. The data cannot be shared with private health insurers to underwrite potentially a policy. But most importantly, the data sit in sovereign, safe environment, and they never leave this environment for any reason.
If you were to name the 3 things that would make healthcare feel smarter, faster, and more personal in the next 5 years, what would they be?
I think the availability of data, the interoperable data infrastructures, and the ability to make research on this data, introduce new biotech products, which will make breakthrough in many diseases that today remains one of the big challenges in the health systems.
What's the most exciting sort of journey we're on at this point?
I would like to see AI truly democratizing care and providing the right care across the planet. And I would like to give you an example. Greece today has 225 islands, most of them with less than 300 people. I would like to be able to build a multi-agentic AI clinical support which will be delivering this algorithmic low acuity care at every island and connecting these people with the right physician when they have a need. And I would like to do it within months and not within years.
And is that where we're headed? Those sort of solutions are going to be very specific to some bespoke data, right?
Exactly. And I think that patients will be trusting the known healthcare brands that deliver great care to use AI tools to help them with their own condition. I do think that intelligence that today is being delivered by OpenAI, by Claude, by Google and others will be at the core of these products. But what matters is all the expertise and what is around them. So the trusted healthcare providers using AI will gradually be the solution for patients accessing for every kind of information they may require.
You've been in the business of sort of international healthcare delivery for years. Why did you come to Abu Dhabi?
In Abu Dhabi, authorities treat healthcare as a national health infrastructure, and they are deploying all these long-term investments, like in the areas of genomics, AI, in life sciences, digital infrastructure. And what they built today, it's a system-level, integrated model, which can be definitely be used as a blueprint of care for other countries to move towards predictive, preventive, and personalized care at scale.
I ask because, cities like Singapore, Seoul, London, Boston are already using AI across significant parts of the healthcare infrastructure. So I wonder what you think that Abu Dhabi's edge is, and on the flip side of that, what it needs to do and where it still needs to catch up.
I think the Abu Dhabi's edge is the integration of all this capability. Today in the UAE, we have introduced pharmacogenomics. So today with a simple physician prescription, each patient knows which is the right drug, which dose for the patient's genetic profile. this is pretty unique. It's accessible across the population. I don't know any European country that can deliver such a service to be a routine for the next 5 years, potentially. So Abu Dhabi has an edge in translating all this capability to practical positive impact both for the population.
Thank you.
Thank you very much, Becky. Thank you.